To me, the Medicare for All Act is an expression of a fundamental human value, which is that access to health care is a right. I have to say that as someone who teaches healthcare policy, the American healthcare system is often held up as an example of how not to build a healthcare system. It is the most expensive system in the developed world, and yet fails to cover tens of millions of Americans. A lot of folks internationally look at the American healthcare system and are very grateful that they don't have to live in a country where access to healthcare is still dependent on your employer, where so many people are trapped in jobs that they don't necessarily want to stay in because they need the health insurance, and where from one day to the next a change in employment could cause you to lose your insurance, or when you get sick and you think you have insurance, you suddenly realize that it doesn't cover the services that you or your loved ones need. You can afford, as a country in the United States, to provide high-quality healthcare services to every single person who lives on these lands. You could do it very easily for the amount of money that you already spend, and probably for even less. But that requires a choice, which is about putting people before profits, and that's why I support this bill.
On average, how many Canadian patients on a waiting list die each year? Do you know?
I don't, sir, but I know that there are 45,000 in America who die waiting because they don't have insurance at all. When my patients are sick, I do not need to ask if they have insurance or if they can afford to pay for my services. And throughout my pregnancy, and for the birth of my daughter in a world-class hospital, I was never asked for money, and I never received a bill. I just handed over this card, my Canadian healthcare card, to my doctor, and that was it. I wish that all of my American neighbors could experience the same simplicity in their moments of need.